Hi, I'm Dr. Flora Waples, founder and medical director of RESTOR Medical Spa, and today we're going to talk about the top 5 most common questions about laser treatments. First question that I get from my patients is, what are they? What does this do? It's a great question. To answer that question, I'm going to give you an analogy about skin. Skin is very, very similar to muscle. Muscle has the ability to regenerate and grow and maintain itself, but muscle is a lazy organ. It won't do it unless it thinks it's necessary. So what do you do if you decide you want to have stronger muscles? You go to the gym, you work out, you put that muscle under stress, and when you put it under stress, it rebuilds itself. And skin's exactly the same way. Skin has the ability to regrow and regenerate, and you know that because when you cut your arm, new skin grows, right? But skin is lazy, the same way as muscle is, and it is not going to rebuild itself unless it thinks it's necessary. That's where lasers come in. We use our lasers to heat different layers of the skin to target different issues, and that heat acts like lifting a weight at the gym acts for your muscles. The heat puts the skin under stress. It creates tiny microscopic controlled wounds, which cause the skin to regenerate. It's a wonderful tool. Next question, number 2, why do we need lasers? It's a great question. The answer is skin, talked about before, is lazy. It can regenerate, but it won't unless it feels like it is necessary. We have to create that controlled wound, and the wonderful thing about lasers is they are phenomenally precise. I can target any structure in a patient's skin, a brown spot, a red spot, a fine line. I can choose which structure I'm going to target, and I can target it with precision. And that's why lasers really shine above things like peels and some of our older tools. Question number 3, how do lasers work? The scientific answer to that question is a process called selective photothermolysis. It's just a fancy way of saying I can tune my laser to target specific structures in your skin. Whether I'm taking out a brown spot or a vein or a fine line, I can choose where the laser goes, how deep it goes, and how much heat it delivers. They're incredibly precise, wonderful tools, and we love to be able to use them. Question number 4, how do I know what to get? Lasers generally fall into 2 classes, pigment lasers and collagen lasers. Pigment lasers are lasers that are used to go after pigments, primarily browns and reds, so sunspots, melasma, veins that occur in the face. A pigment laser is going to be your tool for that. Collagen lasers are the lasers that rebuild the matrix of the skin itself. They're going to improve tone, quality, texture, erase fine lines, get your skin to be more elastic so you have no more sagging along your jawline and fixing that laxity. Those are going to be collagen lasers. So you can look in the mirror and you can decide whether you need a pigment laser, a collagen building laser, or both. But if you have any questions, come in and ask your provider. We can build you a care plan that tells you exactly what you need. The 5th and final question, when should I start? That's like asking, when should I exercise? The answer is now, because rebuilding is much more difficult than maintaining. The better quality you keep your skin in, the more work you do to keep your skin healthy, the easier it's going to be to maintain it in the style that you want for as long as you want to. So when should you start? The answer is now. And those are the top 5 questions that people ask me about laser resurfacing.